a new CEO of health center that's been in place for nearly 42 years, and I think about some of the healthcare reform transition expectations as it relates to implementing the patient-centered medical home model, my vision for the future is fairly bright. And that's because a lot of things have been put in place over the last decade or so in terms of how we move and take care of our patients. We've always talked about the patient first in community health centers, but now we get to actually demonstrate that. We've traditionally talked about productivity, meaning the numbers of folks that come through our doors, and of course that still matters because there are lots of people who'll need our help. But I think the patient-centered medical home is an opportunity for us to talk about the value added to impact the quality of life of our patients. And when you think about that in terms of the dollars spent, it does make a difference for a person that has a chronic disease that may need to be monitored by a health leader or health educator versus a nutritionist versus the actual provider who is licensed at a different level. I think this gives us an opportunity to actually redefine how we provide the right care by the right provider. We know that there are going to be setbacks. We know that we're not going to get it right necessarily the first time. What I would say to a lot of our new staff that are taking this on or being a part of this change is to dare to grow, dare to change, question every step in terms of how do we make this better, not how do we make it work, but how do we make this better? How does this fit our needs? And obviously after reading the instructions and following the guide, then be willing to make the adjustments and changes that fit the community we serve, that fit the team that we're working. That's where the models of excellence lie. When I think about why I do what I do day in and day out, I'm hopeful. I'm excited because I can actually see a difference in the lives that we touch. I can see a difference in the staff that work in our agency. And that's very encouraging for me because it does speak about hope. It speaks about the next step in our lives. You know, when I started this adventure, my hair was a little bit darker, I was a little more flexible, I could do a few more things. And now that I'm becoming more like the people that we serve, I am actually experiencing that need to have skilled staff around me, to have those who are caring, to see the compassion day to day. And I really can experience that firsthand now. I'm very excited about the impact that we have on the lives of our communities. The people we serve are the people we are. And that reflection really, I think it speaks volumes about why we do what we do.